Sunny FM is excited to announce its Couples Retreat 2025.
You're like a dream come true.
The Couples Retreat train is heading to the beautiful city of Takoradi this year. Prepare for a refreshing and unforgettable weekend getaway at the Western Serene Atlantic Hotel, crowned with a special vacation at the Groove, a Sipon Beach Resort. Date 29th to the 31st of August 2025. Lock down the date and get ready to experience a weekend filled with warm fellowship, interactive and impactful retreat sessions, and intentional couple bonding activities that will leave lasting memories. Our time at the Groove, a Sipon Beach Resort, promises pure delight, horse riding, kayaking on calm waters, to relaxing couple walks, couple games, and beautiful moments under the sunset. It's a perfect setting to unwind and reconnect in the most memorable way. The weekend will cost 7,888 Ghana cedis per couple, inclusive of transportation. Registration deadline is the 25th of August 2025. To register, call or WhatsApp 0545 223324 0545 223324. Don't miss this special opportunity to refresh your love, strengthen your bond in a faith-filled and uplifting atmosphere. Let's make this a weekend to remember together.
Trying to see the unknown. Oh, key steps 1, 2, 3. Make you fall in love with me.
Sunny FM is excited to announce its Couples Retreat 2025.
You're like a dream come true.
The Couples Retreat train is heading to the beautiful city of Takoradi this year. Prepare for a refreshing and unforgettable weekend getaway at the Western Serene Atlantic Hotel, crowned with a special vacation at the Groove, a Sipon Beach Resort. Date 29th to the 31st of August 2025. Lock down the date and get ready to experience a weekend filled with warm fellowship, interactive and impactful retreat sessions, and intentional couple bonding activities that will leave lasting memories. Our time at the Groove, a Sipon Beach Resort, promises
understanding fertility options. So Dr. Kelvin Owusu is a wellness consultant with Violet's Medical Center. Doc, it's good to see you again.
Good to be here.
And trust you've been doing well.
Very well, very well. Just
Awesome.
a little bit of a cold, but yeah.
Cold,
It's the season.
Thank God you sound good. We'll manage. You sound great.
Yeah.
And how do you feel about this conversation we're going to be having about fertility? Is it a big thing you're getting?
It is a big thing. I mean, many
your
people.
practice.
Yes, it's a big thing, and a lot of misconceptions as well. So I mean, it's definitely a conversation worth having, and I'm happy to be here to do that.
So you can join us. We are live on Facebook, also YouTube. Remember, you can subscribe to our YouTube channel so you get notified anytime we go on. We place up a video. So Facebook, YouTube, you can also watch us live on Sunny TV. This is the Marriage Unscripted series. This morning, Doc is going to be talking to us about how we can better understand and appreciate the various fertility options there may be for couples who are having fertility challenges. Doc, it's a hard one in this country. Eh? You're newly married. Already people are asking you, when are the babies coming? When are the children coming? And then year 1, year 2, year 3. Some get to year 12, some year 17, some year 20. It's a hard road that some people walk and some couples walk. And I want to know, what are some of the common causes and the challenges that come with walking such a road for couples?
So let's back it up a little bit and understand what exactly infertility is. Because if you follow the society, you might also go and buy yourself pressure that you're not ready for. You know, I mean, as you said, when people get married, the next step obviously is you have to start producing children.
Yeah.
But indeed, there's not every couple that wants to have children immediately after.
Some may not even want to at all.
Exactly. So the goal of marriage may be procreation for you, but it may be a whole different thing for another person. So let's go easy on the pressure. But having said that, if a couple actually wants to achieve pregnancy and they are struggling to achieve pregnancy, then if they've been having, and this is the definition, if they've been having unprotected sex regularly for at least 1 year.
Okay, can I ask you regularly, if you can define the regularly at least for 1 year? That's
okay. So note, unprotected sex means there's no form of protection, no condom, no family planning measure has been put in place. So you are having sex to get pregnant. Regularly means at least, emphasis, at least 3 times a week.
Okay.
Not 3 times a year, not 3 times a month.
That doesn't fall under the regular.
Yes. A regular sex, according to medical definition, is 3 times a week.
Okay.
Again, I say 3 times a week. Oh. This is very important. So if a couple has been having unprotected sex at least 3 times a week for a year, and they've not been able to achieve pregnancy, and I started by saying this is a couple who actually wants to get pregnant, and they've not achieved pregnancy in a year, then we will define them as being infertile.
Okay.
Even the duration, the 1 year, there's a caveat. If the woman is 35 years or more, we are not going to wait for 1 year. And
Really?
I'm sure you're going to ask why.
Yeah.
But when the woman is 35 years or more, we give them 6 months. So once the couple have decided that we want to get pregnant, if they've been having regular unprotected sex for 6 months, that's a woman who is 35 years or more,
Okay.
and they've not achieved pregnancy, then we'll say that couple is infertile. And remember, I said the couple, I didn't say the woman.
Yeah.
This is another area that we need to demystify. Fertility or infertility, for that matter, is 2 people that come together to become infertile. And so it's important to understand that it is not the woman's fault that you are not getting pregnant. In fact, up to half of infertility is a result of a problem with the man. And the remaining half is the result of the woman. Of course, there's a large proportion that we can't explain. Both of the members of the team are fertile, they have everything, their indices are correct, but then when they come together, they're not able to achieve pregnancy.
Yeah, because I've heard cases where they say, doctors say I'm fine, he's fine, but we just still can't make
so
babies.
that one is there. But if you want to talk about couples that have been infertile and have achieved pregnancy eventually, about half of the causes were due to the man, and another half was due to the woman.
Okay.
So both parties can be the source of the fertility challenge, or both of them individually, or both of them as a unit can be the cause of the infertility.
So can we look at maybe individually now causes maybe in men and then the women also, if we can look at that?
All right. So since we mostly blame the women, I'll start with the men. I'll start with the men because we mostly blame the women. All right. So now, let me start with general.
Yeah.
The whole fertility, it starts on the brain. Yes, so your brain must release certain hormones, So if we go back in time, you've heard about puberty. You know about puberty.
Yes.
You see, so it gets to a point, you reach a critical point in your development as a man or a woman, your brain activates a certain cycle, So certain hormone levels begin to go up under the instruction of the brain. And then it begins to stimulate certain parts of your body to begin to develop. So the women will start developing rounder hips, the breast will start developing, and then they'll start having their periods. Then the men will start developing, the genital parts of the man will start getting bigger, the beard will start growing, the voice will start breaking. All these are under the instruction of the brain, And every month for the woman, the brain releases certain hormones that stimulate the uterus to go through a certain process called the menstrual cycle. And so it ends with you having your period. The period is a sign that you are not pregnant. So depending on which side of the divide you're on, when you have your period, you're either happy or you are sad.
Yeah.
So if you are trying to get pregnant and you have your period, then you are not happy. If you are not trying to get pregnant and you have your period, then you are happy. It's all because of the brain's effect on your body. So now, if there's a block between the brain communicating with these parts of the body, the ovaries or the testes, respectively, then you can develop infertility. So whether you're a man or woman, if you have a problem with the brain communicating with these parts of the body, or the hormones the brain is supposed to release that will stimulate the process are not being released properly, then you can develop infertility as a result. So in general terms, when a couple comes in for an infertility screening, there are some tests that are common to both parties, because the brain does the same thing. It's just that because the parts that receive the information are different, that's where the differing effect starts. So the same hormones are released by the brain of the man and the woman to stimulate the process. So there are common tests that we do for both parties. But then now when we come to the male, then we need to find out what other things can cause the man to have problems. So when the brain releases these hormones, they stimulate the testes. The testes will produce certain things, including sperm. So if you have a problem with your sperm, whether the sperm production is challenged, or the quality of the sperm being produced is challenged, or the delivery of the sperm into the it's Christian morning radio, so I have to try.
We get you.
I have to try and be nice, but I'm a doctor, so I mean I have to also break it down. So so if there's a challenge with the delivery of the sperm into the vagina, then we are going to have a problem with fertility from the male side. So what are some of the challenges when it comes to the man? Now, we must understand that there's a reason why the testis hangs outside the body. It's because the testis requires a lower temperature than the rest of the body to produce optimally, And so anything that affects the temperature of the testis can affect your sperm production and by extension, your fertility. Some of these causes are self-induced. The kind of work that we do, the kind of clothes that we wear can actually affect our sperm production. Now, I must always sound a note of caution. The fact that I'll be saying some of these things does not mean that once you are in some of these areas, you will have problems. No.
Okay.
We are talking about statistically, people in such areas tend to have a bit more challenge. But of course, there are also people that are in such areas who've had their 10 children and they are happy walking around. I must say this because we've had issues where you talk about this and then suddenly people are up in arms. So how come I have children? And that's not what we are trying to do here. Okay, so having said that, men who typically wear tight underpants, which push the scrotum to make contact with the body, can struggle because you are equalizing the temperature in the testes with the rest of the body, and the testes does not like that. So the testes prefers to hang freely. So boxer shorts are better than, say, briefs, especially tight briefs for that matter. Then nylon underpants is a big no-no, because it traps the heat. And then wearing boxers or wearing tight fitting underwear, especially as you go to sleep, is not advised. So you need to allow the testes to be free. Men who wear long distance drivers, for instance, because they are sitting for long periods of time, it can affect sperm production. Sportsmen, especially sports like cycling or sports that require you to sit for a prolonged period of time, can affect your sperm production. Men who work in hot areas, say cooks, bakers, smelters, things like those, can struggle a little bit because of the temperature. So all these are what we'll call self-induced. Then there are the other ones that are not self-induced, but men who have conditions like varicocele. Varicocele is a condition where there are veins in the scrotal sac as well. So the scrotum or the scrotal sac is where
we are going to school this morning. If you have a question, you have a comment, you can join us. WhatsApp 0540-130684. 0540-130684. We're talking fertility this morning right here on the IM Drive. Please go ahead, Doc.
All right. So
we're good students. We're following.
Yes. So the scrotal sac is what hangs outside, and the testis is inside the scrotal sac. So the sac also has blood vessels, including veins. Now, sometimes there might be problems with these veins, and they cause the blood to build up in the scrotal sac. Instead of being carried away, it stays in the sac. That can increase the temperature, and in fact, that is the most common cause of male infertility. It's one of the most common causes, and so it has to be dealt with. If you don't treat it, the testes will not have the optimum temperature to produce sperm. Now, if that's not the case and you're actually producing sperm, now what's the quality of the sperm you are producing? So that's why we have to do a semen analysis. There's a correct or good sperm must have one head, one head and one tail, and it must swim forward purposefully. I mean, these are key words I'm using here. So
very, very biblical.
Yes, I'm telling you.
Moving forward.
It must move forward. It must not move in circles. It must not move backwards, So the sperm must have one head, one tail, and it must move forward. So if you do a sperm analysis and then all the sperm inside the sample are moving around in circles, that is not a sperm that can fertilize an egg, because you see, you have to the sperm must find the egg, and the egg is on top, the sperm is at the bottom, so it must swim upwards to the egg. So if the sperm is not able to swim forward in a purposeful manner, then it's useless sperm, in quotes. So you must have good sperm, and like I said, it must have one head. Sometimes, because the sperm, millions of sperms are produced, at a go, so there might be errors in some of the productions. So if most of the sperm in your sample have problems, 2 heads, 2 tails, they are not going to be able to fertilize an egg. So the sperm produced must be good quality sperm.
Okay.
And then I also mentioned the delivery. So if for some reason you've had an operation or you had an injury in the genital area, and so the sperm is not able to move to the vagina to go and do its job, then that's a problem. So we actually use this in vasectomy, for instance, where we artificially block the sperm from reaching the vagina. So if you've had some form of accident that has resulted in something like that, then you can't deliver the sperm to go and do the fertilization. And so when it comes to the man, these are some of the things. Of course, the primary thing is hormones. If you have a problem with your hormones, then you might not even produce the sperm in the first place. So that's where I started from, the brain.
The brain,
so the brain must communicate with the testes to be able to produce the sperm, and you must have adequate testosterone to be able to, sustain an erection, among other things. So all these play a role when it comes to the men.
Okay.
So you can obviously see that there are a lot of problems that can result in infertility for a man.
Yeah.
So it's not only women that are the cause of fertility issues. That's why we started with the men, because the men must understand that they play a role when it comes to fertility. Okay, so now...
So time for the women.
Yes, time for the women. I mean, of course, it makes sense for an uninformed person to assume that the woman is the cause of fertility, because, I mean, hey, the women are the only ones that actually have evidence of of pregnancy.
Yeah.
It's either they are having their period or they are pregnant and their stomach is getting big. So it's easy for you to assume that if you're not getting pregnant, it must be the woman's fault. But as I already established, it's not always the case. But having said that, women also go through a few things. It starts with the hormones I mentioned, so that if the brain is not communicating with the ovaries, then you may not have adequate hormones to even stimulate the process in the first place. But if a woman is having their regular period and they're not getting pregnant, then there could be something else going on. So what are some of the things that could be happening? There might be problems with the ovary itself. A condition like PCOS, polycystic ovarian syndrome, could actually affect the ovary's ability to release an egg. So instead of one egg being prepared for release, polycystic ovarian syndrome causes multiple eggs to be developed, and because there are so many eggs being developed, none of them is able to become dominant. I mean, I'm using a bit of medical term, but there has to be one that will actually stand out and say, I'm the one going to be released. Because of the condition, that dominant cell, that dominant egg doesn't really form, and so at the end of the day, nothing gets released. And so you can just as men are shooting blanks, women can also shoot blanks.
Okay.
And that's the kind of situation where PCOS finds itself. It's a hormone problem that needs to be dealt with for the woman to have a chance of getting pregnant. Okay, so PCOS is one big subject area. Then, if the same as the men, so there must be production and release of the egg. Then the egg must be able to travel into the womb, and that travel road is called the fallopian tube. If there's a blockage in the fallopian tube, the egg will not be able to come out into the womb for that fertilization to happen. And some of the things that will cause fallopian tube problems are typically infections. And that's a big deal, because these infections, sometimes the woman is not even aware that she had that infection.
Yes.
I'm sure you've heard about PID, or pelvic inflammatory diseases.
I have.
So there are many causes of pelvic inflammatory diseases, including STI, sexually transmitted infections. One of the most common causes of STI that many people, it's typically asymptomatic. It's actually chlamydia. It's an STI that's typically asymptomatic. So like I said, the woman is not even aware she even had that problem to in the first place. If you don't know you have it, how do you go and treat it?
Exactly. I mean, how do you even go to the doctor and say, I sense this, or if you don't know?
So that is why they say prevention is better than cure.
Yeah.
And the prevention starts, there are multiple levels of prevention. There's the primary prevention, where you're not even having the sex in the first place. So that's abstinence. If you are going to have the sex, then use protection, especially if you don't trust the partner you are going to have the sex with. Or better still, make sure it's with a committed or married partner, so that we don't have any of those. Exactly.
Married partner for us.
Exactly.
Right, so the chlamydia can be a major cause.
Is a major cause of fallopian issues, because you get the infection, you are not aware, and it festers, it causes damage, and then now the fallopian tube either becomes blocked, or there are some finger projections that are supposed to propel the egg. Those ones are damaged, so the egg cannot be propelled.
So usually this is over a period of how many months or years? If someone has gotten an infection, chlamydia infection,
it's difficult to
hard
put
to
put
say.
a timeline, because
Okay.
first of all, you don't even know when you got the infection.
Okay.
So
Yeah,
how do
I
you even
get you.
determine how long you've had the
Yeah,
infection
yeah,
for?
yeah.
And it's not only chlamydia. It could be gonorrhea. It could be syphilis. It could be just
Any
something
STD.
not even related to
Okay.
STDs. Because like I said, PIDs don't necessarily mean STIs, but STIs are a subset of the causes of PID.
Okay.
So once you have an infection and you don't treat it properly, we have a culture in this country where people will go to a lot of other places to get help rather than the hospital. So
You're
they go and
drinking
take
all
all sorts
sorts
of
of things,
medication, herbal medications,
Yeah.
without tackling the root cause. So that is part of the issue. So the infection affects the fallopian tube, and then now the egg cannot reach the womb, and the woman cannot get pregnant. Or if the woman does get pregnant, because the tube is blocked, the pregnancy occurs inside the tube, and then you have an ectopic pregnancy. So that is obviously a challenge. Then there's a subset of people who have that problem because they've probably had 2 ectopic pregnancies. If you have an ectopic pregnancy and you are treated by surgery, it means that they are going to remove the fallopian tube.
If you have an ectopic pregnancy and
It's treated by surgery.
treated by surgery.
Well, in Ghana, it's mostly treated by surgery because we don't have a lot of the advanced technology to actually deal with ectopic pregnancies non-surgically. And having said that, most women also report hospital so late that we can't even do those techniques even if they are available, because by that time she's close to dying and we don't have time to go and be doing non-surgical. We have to go in and remove the tube.
Wow.
So if you have your first ectopic pregnancy, 1 tube is removed. If you unfortunately have a second ectopic pregnancy, it's likely your second tube will also be removed. So now there's no tube, so no egg will come inside. You understand? So that's the thing. But there's a fundamental problem with, or not a problem, it's biological. So there's a fundamental issue with women in general, which is why we say women have a biological clock. Whereas the sperm of a man, or whereas the man is able to produce sperm till they are dying in their 90s, they are still producing sperm.
Because a recent story I saw, I think 80 something, he's
Yes.
just welcomed his new baby.
Yes, so men produce sperm men produce new sperm every
sperm.
single day.
Wow.
Women are born with a fixed number of eggs.
Okay.
In fact, during the development in the womb, by the time the woman is born, about half of the eggs have already been exhausted. Then the remaining half, by the time you are 30, half of that is also gone. So typically, women don't have an infinite supply of eggs.
Like the
So
man.
that is why we say that women are on a clock.
Okay.
So every month, and remember that every month you are releasing
Yeah.
an egg.
Yeah.
And the fact that you're releasing 1 egg doesn't mean only 1 egg was developing. See, remember when we're talking about the PCOS, I mentioned that multiple eggs will typically start developing, but then one will become dominant. So the fact that you're releasing 1 egg does not mean that only 1 egg was being developed. So women lose a lot of eggs as the days go or the months go by, such that by the time they are 35, 40, they don't have that many eggs left. And that is why women tend to struggle a bit more to get pregnant as they advance in age,
Okay.
especially if it is your first pregnancy. You understand? So that's why even in the definition of infertility, it's 1 year for everybody else. But once you cross
35 and above,
35 and above,
6
it's
months.
6 months, because we don't
Okay.
have that much time to wait. Once you've decided that I'm ready to get pregnant, then we need to, focus all attention to help you achieve that pregnancy quickly.
Okay.
Because we don't have that much time.
All right.
Having said that, now, yes, I said that men produce sperm every day of their lives, pretty much. And so when it comes to achieving pregnancy, men would typically have the sperm available to achieve pregnancy. However, increasingly, research is beginning to point out the fact that delivering a successful live baby is dependent on the age of the man.
Say that again.
Yes, I'm bringing this one up so that the men don't think they are scot-free. Increasingly, research is beginning to show that the age of the man plays a role in achieving a successful pregnancy or delivery. Let me call it delivery.
Delivery.
The age of the man impacts whether the baby that has been conceived. So yes, once you conceive a baby, you are no longer called infertile. But to deliver the baby is a different matter, and that is where the age of the man now comes in.
Interesting.
Yes, so if the man's age is advanced above 40, there's a high risk of the miscarriage rate is higher if the man's age is advanced. So 40 and above, miscarriage rate begins to go up. And so the older your male partner is, the higher the risk of miscarriage due to him.
This is
not
rather
the woman.
interesting, Dr.
Yes,
Kelvin.
even though we are discussing infertility, I wanted to chip this in so
Yeah,
the
I
men
mean-
to don't wait too long to to start.
Just because you
a
are
family.
producing fresh sperms every
Exactly.
day. Oh, interesting. Well, Doc, are you done with the women?
Yes.
But can
yes.
I ask you about fibroids? I mean, lately
Okay.
young women are very concerned about fibroids. I've seen young women who are newly married, maybe had one miscarriage, and the doctor says they have a fibroid, so they're thinking, let me go take the fibroid out, so my fertility options are more increased. Some are being diagnosed with fibroids as early as maybe 20 something, and they feel it's a major barrier in being able to conceive. If you can touch on that for me.
So I intentionally left that out because I knew that question would come up.
You knew it would come, eh?
Okay, so now fibroids are always a little bit tricky, so we don't just add them to the general discussion per se.
Okay.
So by themselves, fibroids do not affect fertility. So fibroids will not prevent you from getting pregnant or cause any problem with delivery per se. You understand? However, and as you rightly said, if a woman is struggling to get pregnant, and we discover that there's a fibroid, especially a fibroid that is located in the area where the baby would have been planted, then that fibroid has to go.
Okay.
You understand? So now the fibroids can occur in different parts of the womb. The womb has 3 layers. You mentioned that we are going to school, so let's go to school a little
Today,
bit.
they're full students on the IM drive. Yeah.
The womb has 3 layers. There's an outer layer, there's a middle layer, and there's an inside layer. The fibroid can occur in the outer layer. Typically, fibroids that occur in the outer layer, they just grow big and they distort your abdomen,
Okay.
But they don't really affect your chance of getting pregnant. They may affect delivery, especially if they find themselves in the low place where instead of the cervix was supposed to open to allow the baby to come out, but if there's a fibroid sitting somewhere there, it'll be difficult for the cervix to open, so then it can affect delivery, but it will typically not affect conception. Okay. Now, then there's a second group of fibroids that are in the middle layer. The middle layer is the muscle layer. They also typically don't affect getting pregnant per se, but again, depending on the location, they could distort, they could affect delivery because now they are the muscle layer. They may affect contraction and all of those things, and they can also cause significant pain. So if it's causing significant pain and discomfort, then you might have to remove it.
Okay.
The fibroids that we are most concerned about when it comes to fertility are the ones in the inner layer. The inner layer is the layer that is also in contact with the baby, the developing baby. So if there's a fibroid in the inside layer of the womb, it can affect or prevent implantation. And so people with such fibroids can struggle with miscarriages because the baby might even implant, but then it's not able to express itself, for lack of a better word, and so the pregnancy is terminated. Or the placenta is struggling to find a place to attach, so that the baby gets terminated. Or this woman has significant heavy bleeding because anemia can prevent pregnancy. I mean, anemia, you are struggling to sustain your own, your body's own needs. So how do you feed the baby?
Support another baby.
So if a woman has a fibroid in the inside layer and it's causing heavy bleeding or pain, those fibroids can also cause pain, then they may not even get pregnant in the first place because of those effects. So if such a fibroid is existing, then it definitely has to be removed for the woman to have a chance of getting pregnant.
Wow. This is Sunny 88.7 FM. I love Dr. Kelvin, how he breaks things down so you can carefully understand whatever he's touching. So today we're talking about understanding fertility options. He's touched on the causes of infertility that could rear its head amongst couples, some of the challenges that come with it. Doc, you have a question here. It says, is it possible to have your menses when the fallopian tubes are blocked?
Yes. I mean, fallopian
asking.
Remember that I mentioned that menstruation or the menstrual cycle is under the influence of the brain. It has got no bearing on whether there's an egg or there's no egg. The menstrual cycle's goal is to prepare the womb to receive a baby. And so whether there's an egg released, whether there's fertilization or not, that process is going on. It's like I'm building my house and I mean, I don't have money. So I completed the bedroom and I've left the hall uncompleted. I can still sleep in the bedroom.
Yeah.
You understand? The hall is not complete, but the bedroom is complete. So that's how the menstrual cycle works. It prepares the bedroom for the baby, and so it has no bearing on the egg presence or absence. If the egg is released and the sperm meets the egg, then they have a place to go and sleep, which is the bedroom, which is the womb. If the egg does not meet the sperm, well, the bedroom was prepared anyway, and because it didn't come, now we have to we have to sell off everything. So the menstruation is like the body selling off all the things that he had purchased in preparation for the baby. The baby didn't come, so now let me sell off so that I can prepare for another baby. So that's what happens every month. Every month the womb prepares itself to receive a baby. The baby doesn't come, we sell off everything. Then the next month we start again. We rebuild the room. The baby doesn't come, we sell it off. So that's the whole concept of the menstrual cycle. So whether there's an egg or there's no egg, it doesn't matter.
You can join this conversation. WhatsApp, you can drop a message 0540 130 684. 0540 130 684. You can also drop a message via Facebook Live. This one says, can fibroid cause pain during menstruation and ovulation period, Doc?
You see why I didn't want to bring the fibroid in.
But it's a major challenge for women. So
especially so since they are asking questions, let me just break down fibroids.
And you're a station where women are listening. So today you couldn't have run away from fibroids.
So fibroids, I mentioned that fibroids are a bit tricky.
Yeah.
It's a woman issue, and especially a black woman issue. If you up to 80% of black women will develop fibroids in their life. In their fertile life. Fertility ends when menopause begins. So once a woman is fertile, the risk of fibroid is there. The fibroids are the same hormones that stimulate the womb to prepare to receive a baby. The menstrual cycle, those are the same hormones that stimulate the development of fibroid. Let me break it down a little bit for the layman to understand. Because the womb, every month the womb gets bigger, so that's where the bloating and all those feelings come from, because it's preparing to receive a baby. So it gets a little bigger, then it gets smaller when the baby doesn't come. So that whole expansion contraction thing, some of the muscles also get upset. They're like, why are you causing me to become bigger and smaller every month? So they go haywire, and the haywire muscles and cells are what develops into the fibroid.
Okay.
I'm stressing on this because me personally, I've sat in a trotro. And the trotro scientists have come to stand there, and they said that.
That's what you call them, Doc.
But what else are they?
Trotro scientists.
And they claim that when you have your period, you are supposed to bleed for 8 days. I don't know where they got that information from. And so if you bleed for 3 days, the 5 days that didn't come is what congeals and becomes fibroid. Please, this one I'm saying to the camera. There's no relationship between the blood and fibroid. You cannot bleed fibroids out, and there's no medicine that you take that will melt fibroids. So let me answer that question before it comes. The problem we are having today, and the reason why a lot of people are complaining about fibroids, is because we have an open health system where people can just walk into any scan center and go and do a pelvic scan. I already said that 80% of black women have fibroids. Whether they know it or they don't know it, they have it. So if you go into a place and you do a scan, for whatever reason you are doing it, they might discover a fibroid. So there are a lot of women who, once they hear that they have fibroid, then they begin to attribute a lot of their problems to the fibroid, which may not have actually been the case, because most fibroids are silent. Like I said, you probably were you were pregnant and you went for antenatal and they said go and do a scan, and then you discovered they had a fibroid. The fibroid was there minding his business. It wasn't causing any problem per se. But having said that, there are also fibroids that can cause significant pain and discomfort, especially during your periods. It can cause significant cramping because some of them can disrupt. They cause an imbalance in certain hormones, prostaglandins, among other things, and that can cause significant pain and discomfort, cramping. Some can also cause heavy bleeding. Even during pregnancy, some fibroids can cause something we call red degeneration. It can be very, very painful. So yes, some fibroids can cause a lot of problems, but most fibroids are silent.
Okay.
And so if you were to do a scan and you found out that you had a fibroid, don't just conclude that everything you are suffering is because of the fibroid. It's best you go in for a proper evaluation so that we know that there's no other thing causing the problem. If we do conclude that indeed it's the fibroid that's causing the problem, then we need to remove that fibroid. You understand? So in other words, it's not every fibroid that you see that needs to be removed. You understand? And then now, because you are still in your fertile period, if we take out the fibroid today, so long as you are still having a period, your uterus is getting bigger and smaller every month, you could still develop another fibroid tomorrow that would also require intervention. So that is why we are not in a hurry to go and remove fibroid, because if you remove that fibroid too early, you could have another situation where you have to do another fibroid surgery a little later
Some people
on.
have had to do like 4, 5
Exactly.
surgeries.
Exactly. And so it's important that we make sure that whatever you are experiencing, there's no other solution to it.
Okay.
Because I already mentioned that there's no medicine to melt fibroid. And so if we have to deal with fibroid in Ghana, it's mostly about 80% of the time is surgical.
Surgery. This is Sunny 88.7 FM. Doc, thank you so much for breaking things down for us. Mommy has described it well. It says, I think now it's like our minds just kind of, there's been an eureka moment for most of us. It says, fibroid is caused by rebellion then. Copy that. But why is it prevalent in Black African women? I'll get to some of these questions popping up. But Doc, let's look at solutions for couples who've been there, they've done that, they've discovered that there's a challenge, whether it's one or it's both. What are some of the solutions that the medical field has for such couples?
So first of all, like I said, we need to identify the possible cause of the fibroid, of the infertility. Is it the woman, is it the man, or is it both? Because for instance, the fact that a man may be on the lower side of the normal sperm, it might not be a big deal if everything is fine with a woman. So if the woman has a small problem and the man has a small problem, then when you put them together, that problem may be magnified. So we need to identify who or what is causing the problem, and then we can figure out how we are going to deal with it.
Okay.
If, for instance, there is a hormone problem, the brain is not releasing enough hormones to stimulate the production, then we may need there are medication to help regulate that. So a lot of the time, some women are given medication to stimulate either egg production or egg release, things like that. But I almost forgot one thing. There's also the element of the family structure or the family setup. The man is working in Accra, the woman is working in Tamale. They only meet once in 3 months. You understand? That is not a medical. It is most likely not a medical problem.
You're not checking the box of at least 3 times a week.
Exactly. So actually, so most of the time, most of the time we don't actually intervene with medication.
Okay.
Most of the time it's just counseling to let them understand that the thing is inadequate sex. You see, some people have this perception that they must have sex during the woman's fertile period. So the fertile window or the safe period, that calculation. So they only have sex when the woman is fertile. We are not animals. We are not dogs to only be having sex during when the partner is on heat, and it typically does not work. There's an element of stress in all of this. You see, stress, the body's response to stress is the same regardless of the source of the stress. Whether the stress is your deadline at work or exam time or trying to get pregnant, the body's response is the same. All stress is stress. And so the same technique that is used to handle stress is the same, which is the release of stress hormones. So, and the stress hormones, obviously, I don't know if it's coincidence, the last time I was here, I used the lion example, so I'm going to use it again.
Please go ahead.
If a lion was to enter this room right now, you would need certain hormones, and adrenaline being number one, to escape that lion, right? The adrenaline will be released and to stimulate your muscles to, begin to run away from the lion. That adrenaline or those stress hormone or that stress response is the same stress response if you have an exam to write. When the lion enters the room, erection and sex is the last thing on your mind. So when those hormones are up, those hormones prevent the sex hormones from working. They prevent the brain from releasing all those stimulatory hormones. So that is why, for instance, when a woman is going through stress, her period becomes irregular. Sometimes it doesn't even come at all because the stress hormones are blocking. They are telling the brain that, Massa, relax. We are dealing with money issues. We don't have time for baby. You understand? Mm-hmm. I'm saying this because when you begin to have sex only to get pregnant, it's a stress for the body. So the body begins to respond to that situation by releasing stress hormones. You can't expect to get pregnant when your conditions are not right. When you travel from Tamale to Accra, it's a stressful journey, especially in these days that the road crashes and all sorts of things happen. It's a very stressful journey when you are sitting on potholes. So by the time you arrive in Accra to meet your partner, your stress hormones are high. You cannot expect your body to release an egg at that point. So if you're only coming to Accra to spend the weekend with your partner, you can't expect to get pregnant because you are stressed. And so you need to have time You see, and it's interesting. If you are not planning to get pregnant, you see, because you're not planning to get pregnant, you are relaxed. Everything is calm, and that is why it's so easy to get pregnant with a one night stand. Because hey, I mean, you are just having fun. You see, but once the pregnancy becomes an issue, and especially you find yourself in a society where people begin to put pressure on you, you must get pregnant. Oh, but I just delivered the first baby. Yes, you must still get pregnant. So there's even secondary infertility as well. You see, so stress can prevent pregnancy. So living apart is it's a stressful situation for a lot of couples, and it can prevent you from getting pregnant. So when you counsel the woman when you counsel the couple about these things, and they find a way to solve it, most of the time they're able to get pregnant within a few months.
Interesting.
You see.
Okay.
But if everything is right, they live together and they are still not getting pregnant, then we must find what is causing it and then deal with that issue. So if it's a hormone issue, we do some hormone therapy. If it's a tube issue or a blockage issue, sometimes we might be able to reverse the process, reverse the blockage. There's something we call HSG. HSG is an investigation that is done especially in women to try and see if the womb is patent. When I say patent, like the tubes are open and everything is fine. Sometimes if the blockage is small, it's a very minimal blockage, that HSG process can actually open it up, and then people have been known to get pregnant after an HSG.
Okay.
It doesn't mean you should get up and go into HSG because it's exposure to radiation. We don't do it for just for the fun of it.
Okay.
You understand? So it doesn't mean that everybody should go into HSG. No, I'm just saying that unintentionally, HSG tends to open some of the minimal blockages, and it's able to allow the egg to enter the womb and the fertilization occurs. The man has low sperm count. There are medication or there are therapies that can help do all of those things. If all the medical measures have failed to achieve pregnancy, then the next thing would be assisted reproductive technology. I've even forgotten the phrase. Where one of the most common ones that would be IVF. Where we would take the egg and we take the sperm and we do the fusion in the lab, and then we implant it into the woman's body. There are other techniques as well. Artificial
I hear that
insemination.
there are higher chances of getting multiple babies from IVF. Is that true? Or is just
There's always a chance that it might fail. So they tend to implant more than one baby. So there is a chance of all of them actually taking, and then you have multiple pregnancies. Again, it does not also mean that you should go and do IVF because you want twins.
Okay.
So I mean, all these are factors that we can consider and interventions that we can make to help infertile couples deliver babies.
All right.
If all fails, adoption is still an option as well. If you've done everything, you've gone through the whole gamut of assisted reproductive technology, and still you are not able to achieve pregnancy, then adoption becomes the final.
Wow, this is wonderful education we're getting this morning. KKJ is listening, says this is very insightful. And this message here says, my menstrual cycle is inconsistent, sometimes 28 days, 32, 40 days. How do I determine my fertile window? Yeah.
That's a very technical question.
Yeah, calculations has come inside.
Very technical question. Okay, so first of all, no woman has a fixed menstrual cycle. So what we talk about, we use the average menstrual cycle. So you might be a 28-day average, but then really it's 25 days up to about 32 weeks, and then we strike the average and we settle on 28 days. That's actually why we don't typically use the fertile window, or we advise not to use the fertile window. Just have your sex 3 times a week, and you will definitely catch that window. I think
I will not forget this today. 3 times a week, regular.
Because if you try, and I touched on this as well. So let's even assume that you have a regular 28-day cycle. You have an exam coming up, or salary has delayed. That can disrupt that cycle. So which window are you going to really use? You see, so we typically don't do menstrual cycle calculation per se. However, if we do have to calculate, there's a way to calculate. We find your longest cycle. So she says 40. And then we find your shortest cycle, which she says is 28, and then there's a factor that we apply to them to give you an estimated fertile window. and then we do. The only time we actually use this is some of the interventions might require that
information.
Okay. To be able to do that intervention. So that's when we apply all those things. But it's not something that the general public should be stressing themselves on.
All right.
Or about.
This message says the discussion being recorded is on YouTube. You can always go back to it. Facebook as well. This one says, Jennifer, a food morning to you, and thank you so much for timely insights. I need Doc's number. I will visit him for further discussions. Keep doing you, Sunny FM. God bless you. Thank you. So I want to get back to Doc. I think I saw some comments on Facebook. Let me get to this one. Okay, Queen Akusia Cornelius watches says, thank you for this discussion. I'm learning a lot. Sarah Yikai Kote has also joined us, says, enlightened. Let me get back to Doc. I want to find out if there are some lifestyle, some things we're doing, that could be negatively impacting one's fertility chances.
Yes, I mean, definitely. I mean, lifestyle makes a huge difference. So it starts with our routines. What are we eating? Are we physically active? Because again, obesity has been associated with infertility. Or let me put it this way: sudden weight changes. So you were very slim, you got a nice job, and now suddenly you are bloating or you are becoming bigger. That sudden change can affect your fertility as well. So obesity as a unit can affect fertility, and then sudden weight changes. So suddenly slimming down, suddenly gaining weight can also affect fertility. Smoking and alcohol, but smoking especially will affect fertility. It will affect your ability to get pregnant, and will affect your ability to maintain a pregnancy. So it actually affects both sides of the divide: your ability to get pregnant and your ability to maintain pregnancy. Diseases like hypertension and diabetes can also affect fertility as well. Both of them, if poorly managed, can cause infertility and can also cause miscarriages. So both of them are implicated in this as well, and this affects both the man and the woman.
Okay.
As well. I mean, these things. So the obesity, the smoking, the alcohol, the hypertension, and the diabetes can affect all of that. Then something that we typically don't talk much about, but it's an issue: masturbation and its relationship with premature ejaculation. You see, I mentioned that the delivery of the sperm must be delivered into the back of the vagina. If the semen must be delivered into the back of the vagina. If it's not reaching there, the chance of it getting into the womb is very slim. Premature ejaculation is one of the conditions that can prevent the semen from reaching that goal. And masturbation is one of the biggest causes of premature ejaculation, especially amongst the younger age group.
Okay.
So there's that connection as well. And it's a lifestyle. I mean, it starts as a lifestyle and then becomes an addiction.
Yeah.
So if you can deal with it at the lifestyle stage, it will definitely help.
Wow, what a morning. This is Sunny 88.7 FM is the Marriage Unscripted series. In fact, we're preparing for a couples retreat in Tadi, 29th, 30th, 31st of August. And if you're considering joining us, we'll be glad if you can, just so you can have a chill out time, you and your spouse together, create some new friendships with other, like-minded couples who are there to, make sure you're investing in their marriage, also growing, dedicated to growing in their marriages, learning and unlearning. It will be 29th again to 31st of August. Will be with Paul and Linda Mante, also Professor Nyako and his lovely wife, and we'll have Paul and Michael and Letitia Ohiniafa. Those are three resource persons. We'll have a full day at the Grove Sipon Beach Resort just to relax and have a good time. Some of you haven't had a good time to relax in a long time, too much stress. You can join in the couples retreat. If you have any messages, you can reach out 0545 223324, 0545 223324. Doc, to wrap up, if you can suggest some resources, or if there are some support systems that you would recommend for couples who are facing fertility challenges today, what would you say? What would you share with them?
So it starts with the family units. I mean, and that's why this is a couple affair. Typically, you'd have the woman coming into the hospital and saying that she's been trying to get pregnant, and the question is, by yourself? No, So it starts with the the two people
two of
involved,
you.
coming together to understand that, I mean, it's the two of us. We need to support each other, so that's where the support begins from. The larger family most of the time don't understand some of these things. I mean, let me give you a personal experience.
Sure.
Actually. So when we got married, my wife and I, we had decided.
Doc, you've been married for how many years? Let's go into your life small.
Well, I got married in 2013.
2013,
so,
okay.
It's been a while.
Almost 10.
Yeah, almost. So no, it's past. It's
Past 10,
yeah,
actually.
Past 10.
Past 10.
Hey, I've grown. Oh. So when we got married, we actually decided that we're not going to have children. We wanted 2 years before we would actually have children. It was a decision that we had taken. And it's interesting the number of people that were asking us, when are you giving birth? What's the, is there a problem? The amount of prophecies and prayers that people prayed on us to get pregnant. And they're like, look, you are praying and we are blocking the prayer. What is all this stress? You see, so even we as a medically enlightened couple, we face this. So imagine the ordinary person who really does not know what they are doing, going through that same thing. Even after you have made a decision that I'm not getting pregnant for the next 2 or whatever number of years, So the extended family and the extended society, we all need to understand that, that question, when I get giving birth, or when is number 2 coming, when is number 3 coming, it doesn't help. Especially when you're not contributing to the school fees, because
that's exactly what I was going to say. I mean, when you ask me, I ask, are you going to pay the school fees? Are you going to be a nanny for the next child you're asking for?
It doesn't help. That's a society or a cultural aspect, a cultural support system that we really need to work on.
To look at it,
so that we can reduce the pressure. Unfortunately, I'm not aware of any social network of support in this
that
space,
regard,
but there are professional support systems, so the doctors are there, and we typically work with psychologists as well that can help you either individually or even as a team, but the most important person that must support, or that must lend support in our cultural setting, is the man.
Okay.
Is the man and the man and the man, because if the woman has the male partner support, it's I mean, research has shown that she's able to withstand the pressure much better.
Yeah.
So men, stop leaving the women to come to the hospital alone to come and ask about fertility, because it is not we are not amoeba. We don't do asexual reproduction. You don't just sit there and split into two. You understand? So please don't let the women
taking me
come
back
alone.
to my science days in St. Rose's, University of Ghana.
It's true. So if a woman comes to the clinic without their male partner, it's difficult to send them back to bring the male partner, but we always advise them that when you're coming the next time, please bring your male partner along, because the 50% of the time they are the cause, and then 50% of the time the women are the cause. So we need the two of you so that we can, if for nothing at all, the counseling goes both ways. If the man is aware that I'm supposed to have sex 3 times a day, I know that.
Hey, Doc, you said 3 times a day.
Sorry,
3 times a week.
Well, I mean,
Doc, I've taken notes, but 3 times a day, of course, is also fine. But the box I know we need to be checking today is at least.
I know. It's interesting that most of the time we assume that the men are the ones who always want to have sex.
Yeah.
I've had couples in my consulting room where the problem is actually the man.
Okay.
The man doesn't want to
not
have sex.
Interested.
You see, so it's not always that the women are the reason for the limited sex time. Sometimes the men may actually be the cause, and so it's important that we all come together and then we do the counseling properly so that we know what to do. Because like I said earlier, most of the time, just by counseling and adequate sex, we're able to solve the problem.
Wow. I think you have a final question, which I think you've sort of answered already. It says, if the man is stressed, does it affect conception?
It does. Yeah, it does a lot. I mean, if a man is stressed, they might struggle to achieve an erection first of all, or they may struggle to maintain an erection. A lot of premature ejaculation. I know I mentioned masturbation as one big cause, but the second big cause is stress. The man can't focus on what's going on, especially when it's time to pay school fees or salaries have delayed. I mean, there are bigger things to deal with. So and the body knows what is important. So the sex is not really important at that particular time.
All right.
So yes, stress can affect and does indeed affect men's performance as well. And then even related to stress, where you live, you understand, it matters.
The last time I remember you mentioned that.
Everything, you see, when it comes to medicine, especially when we are doing lifestyle related issues, everything relates to everything, you see. So if you are living in, let's say, Kaswa, and you're working in central Accra, you are spending 3 hours in traffic in and 3 hours in traffic back. you will have problems. You understand? You will have problems in multiple aspects of your life. So as much as possible, we need to factor all those things in. If you live in Kwabenya, for instance, you're working in Central Accra, the amount of traffic you sit in alone,
it's crazy.
It's crazy. And so you get home, you are wired up. You are stressed. It's not surprising that you are probably dealing with some of these things that we are talking about. Yeah. So we must factor all these little things in. Okay. And exercise. So I mentioned all the intervention. Exercise actually plays a role.
It does.
It does play a big role. Exercise by itself is a form of stress relief. So you get home, you are stressed. You go out and you jog. As the air hits your face, it actually cools you down, calms you down, and drops some of the stress hormones. So exercise, major role. Fruits and vegetables, it helps. The antioxidants can help reduce some of these issues as well. So have time to actually de-stress.
I think what you're saying about exercise is true, because I said I wanted 2 children and I had 2, so I knew, I'm done. And then I went to join a group, TNU, a fitness women's movement. Doc, it wasn't long before Ajwa came.
Yes.
So I was telling the founder, Senna, this was. So he says, you should, when the women come, this, and I said, why didn't you tell me? Then I wouldn't have come to join. I recognize what you're saying.
And for the men, this is free advice.
Okay,
for the men,
give us free advice.
Your woman is one of those that does not like to have sex. Get her exercising. Go start jogging together. Exercise actually improves libido in both male and female.
All right.
In male especially, it also improves what's the thing called? How long you last. I've forgotten the medical term. So if you are looking to last long in bed, exercise, especially aerobic exercises, so jogging, swimming, tennis, dancing, all the skipping, it helps improve stamina. That's the word I was looking for. So stamina, libido, it helps. So
advice.
It reduces the stress, it boosts libido, and it improves stamina.
That's
what
fantastic.
more do you want in life?
Doc, in fact, you've given us much more than we asked for, we prepared for today. It's been wonderful having you, always insightful. I particularly love the way you break things down. It just seeps in well. Thank you so much for coming on. We've been talking about understanding fertility options. I think Doc has done more than that for us, and plus the free advice. Doc, for those who want to reach out to Violet's, if you can drop a number or contact. Yes.
Okay, so you can actually follow us on social media, Violet's Medical Center, Instagram, Facebook, TikTok, etc. And you can also call us as well, 054 059 9383. You can reach us over there as well. And you can also find myself as Kelvin Owusu on all social media platforms, Kelvin Owusu MD. On all social media platforms.
So guys, don't you agree when I say he's like our favorite doctor here at Sunny 88.7 FM? So definitely, this is our second time. I see the third and the fourth and more coming. Doc, thank you so much for joining us on the Iron Drive. Thank you for your time with us this morning. We truly appreciate you. And couples are reminded of our couples retreats, great gathering, whether you've been married 2 years, 3 years, 5 years, you've done 20, you've done 30. You can join us to be a part of the Couples Retreat 2025. Great time away will be at Takrady Western Serene Atlantic Hotel. You can find out more information at 7,888 Ghana cedis per couple. If you're not joining a transportation, that reduces your cost. In fact, you have a few people are joining us from other regions coming on. So if you wish to come, please at least try and make a deposit. Latest by the 25th of August, you make your final deposit. You can actually make an outright payment as well. For those of you who are wondering, can I come with my children? We have some help for your children. So you can reach us 0545 223324 0545 223324. This is Sunny 88.7 FM.
Moves Fast is excited to announce its Couples Retreat 2025.
Like a dream come true.
The Couples Retreat train is heading to the beautiful city of Takrady this year. Prepare for a refreshing and unforgettable weekend getaway at the Western Serene Atlantic Hotel, crowned with a special vacation at the Groove, a Sipon Beach Resort. Date 29th to the 31st of August 2025. Lock down the date and get ready to experience a weekend filled with warm fellowship, interactive and impactful retreat sessions, and intentional couple bonding activities that will leave lasting memories. Our time at the Groove, a Sipon Beach Resort, promises pure outdoor delight, horse riding, kayaking on calm waters, to relaxing couple walks, couple games, and beautiful moments under the sunset. It's a perfect setting to unwind and reconnect in the most memorable way. The weekend will cost 7,888 Ghana cedis per couple, inclusive of transportation. Registration deadline is the 25th of August 2025. To register, call or WhatsApp 0545 22